I just want to let you know I'm here. I'm learning so much. I think DOH, we have a strength of trying to educate the general population, but targeting certain populations. We'd love to work more with speaking definitely with our cancer partners, not just through the hospital system or ambulatory surgeons, but bringing in community health workers and other people that meet that local area so that they can speak about and bring that education of the importance of blood clots and thinking, hey, we're seeing more Black women with cancer. One of the things when you're talking with the doctor, so you can start that conversation as well.
There's a reason why we have standards in our survey, and I can tell you the survey process drives behavior at the facility level. In terms of what staff are going to do, administrators are going to do, I can tell you, and without question. And if you put it in the Resident Bill of Rights, it really compels administrators to a whole different level, because Resident Bill of Rights in an ALF or nursing home is an additional standards of civil rights that go beyond your normal civil rights, that provide significant protections because they really drive administrators to be absolutely zeroed in on compliance and adherence to those things.
So Johns Hopkins actually went through this very issue, and what they were finding is their patient refusal was actually high because they didn't understand it necessarily, and so it actually came down to the nurses and educating the patients. It wasn't the doctors; it was actually the nurses that were responsible for that to be documented. That Dr. Mr. So-and-so's asleep and he didn't want to take his anticoagulation.
Yeah, that's right.
So there's, again, we don't need to recreate language that already exists, but they put these policies in place that actually had a demonstrative impact in terms of reducing
This is such a prolific problem. And I tell you, every time we talk to anybody, everybody's got a blood clot story. Everybody has a story to share anytime we have a conversation. So we know it's growing. It's a major problem. And I think, obviously in the Medicaid health plans, the extent to which one health plan picks it up, as soon as one health plan picks it up, if they have dual enrollment for Medicare, Medicaid residents or consumers, I can tell you the dual eligibles, the health plan's going to pick it up on both sides. Because it just simply makes sense. It's simply good Florida common sense.
Florida, I mean, we are a state that can do so much with, we are setting standards. I mean, when we reported to CDC, I remember for the cancer registry, we probably got the lowest processing rate of a cancer record for, any state. And we're seeing, second to California. I mean, we, as a state, we only had one cancer registry. California had several regional. We are efficient. We are utilizing state dollars very well.